Hello, I'm Dr. Stephen Blomerth, and welcome to Natural Health Today. This is a show that talks about things that you'd like to talk about, health concerns that you may have, problems that you may have with a friend or a family member. And we offer you several different ways to participate in our show. You can actually send us an email at pbdchiropractic@gmail.com, or you can telephone my office at 978-535-6155, or you can send me an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. But whatever way you choose to participate in the show, we'll talk about natural health means to help you get better, to feel better, to lose your pain. And many of these things involve a fair amount of participation and self-help on your part. Some of it involves consulting with a natural health practitioner. And I think of natural health as breaking down to 4 different areas that we utilize in my office. One is joint manipulation, because a stuck joint, you might not even know that a stuck joint. For instance, sometimes when a person has a problem in their knee, if you adjust that person's foot, you'll find the knee pain goes away immediately. I've even had people have problems in the neck. Well, sometimes if you adjust the foot, that neck pain will go away, because the body is a series of interrelated moving parts. And if one part is stuck, the symptom may show up in another area. So joint manipulation is an important part of getting people better. But sometimes muscle work, and I'm talking about muscle work in terms of trigger point therapy, finding areas in muscle or muscle connective tissue that don't move, don't slide, don't glide, and don't help the person have full function in all areas of their body. So the muscle work can go a long way towards helping people feel better and get back to normal function. The third way of helping people is through exercise, and I'm not talking about the type of exercises you get at a gym. I'm talking about the exercises that work the muscles that don't get attention on an everyday basis. Unfortunately, the exercises that most people have known and see or seek out at a gym or at a physical therapist tend to be work on machines or weightlifting, and there's certainly a place in the world for that, but for most people who have musculoskeletal aches and pains, neck pain, back pain, knee pain, they need exercise to work the muscles that don't get the everyday attention, that work the little-known muscles that sometimes are too tight and other times are too weak. And so we use what we call foundation training exercises that just require learning, but they don't require you to go to a gym. They don't require you to have any special exercise equipment. And the thing that I found out that I really like is they don't take a lot of time, and they almost always bring immediate relief, and they give you a sense of feeling more energy. And the fourth way that I think of natural health care being effective is in nutrition. And I'm not talking about just taking a pill or supplements. Sometimes that's required, sometimes that's necessary, and it can be a good idea. But I'm talking about the kind of foods that you eat, and more importantly, the type of foods that you shouldn't eat. When you put all those 4 together, you can help many, many people get better, because I think probably 80 to 90% of day-to-day health care problems that people consult with their medical doctor, where they get some type of drug or injection or surgery, are unnecessary, because they can be helped by the 4 pathways that I just outlined under natural health care. So if you send in your question, we'll slightly disguise your name, and we'll talk about ways you can help yourself get better. So I'm going to put on my reading glasses, and let's look at some of the questions that have come in since our last episode. Okay, Vicki writes in from Danvers. She says, I like to run for exercise pretty much all year long, but lately if I run more than 2 to 3 miles, my feet start to burn. It burns up by my big toe and the one next to it. I've tried changing socks, but it doesn't seem to help. My feet and toes feel stiff sometimes at the end of the day too lately. Okay, Vicky, there's many different things that can make that burning sensation by the big toe, but I'd say probably the biggest thing that alerts me to your symptom is something called Morton's neuroma. Dr. Morton was a person who wrote many different papers, so if you look online about Morton's neuroma, you may also find Morton's toe. But Morton's neuroma is when a bundle of nerves gets irritated in your foot and gets caught between two of the metatarsals. Now, I can't show you my foot right now, but I could show you my hand. In the hand, these bones in here are called metacarpals, but in the foot, they're called metatarsals. But if you can imagine that your fingers are analogous to your toes, if you can imagine that if you go beyond your toe, down in through here, and feel there's like a little groove, a little trench. Well, there are blood vessels that run in through there, and there are muscles that run through there. There are also nerves. But sometimes in your foot, these bones, because sometimes we run too much or we just don't have a lot of space, these bones in here, called the metatarsals in the feet, get kind of smushed together. And when they get smushed together, they can crush down on that nerve. And when a nerve is crushed, it can kind of give a burning sensation. So one way you can test your foot yourself is, if you can reach it, try squishing your metatarsals together. It'd be like squishing this area in your hand together, and see if that makes the symptoms worse. If that makes the symptoms worse, that's kind of a hallmark sign that a person has what we call Morton's neuroma. How do you treat Morton's neuroma? Well, you could go to a podiatrist and you could have it cut out. But before you go to that type of extreme case, I would suggest you can have soft tissue treatments in that area. You can have these joints in your foot adjusted and moved and make them have normal motion and normal space in there. And you can even do things on the bottom, say in this area here, in between those bones. You can work a soft tissue back and forth to break up any adhesions that might have formed. If those adhesions are broken up so that they're no longer crushing down the nerve so much, your burning pain will likely go away. So there's several different things that can cause burning sensation into your toes, but since your burning sensation only comes out with running after 2 or 3 miles, I would say consider having a Morton's neuroma looked into, because treatment of that can be quite conservative, and it doesn't need to be necessarily injections or surgery. So Vicki, thanks for that question. Let's go on to our next question. Okay, Ed writes in from Middleton. He says, I've been doing a lot of babysitting lately, picking up my granddaughter who weighs about 22 pounds. Now getting her in and out of the crib tends to hurt my shoulder. And my shoulder also hurts me when I have to put my arm in my jacket, but not when I lift my arm straight up overhead. Any ideas on what I did or how to fix it? Okay, Ed, well, I'm going to do a little demonstration, and we'll talk about what you might have done and an exercise that might help you. So I'm going to take off my jacket, and we'll demonstrate. What Ed said was, it hurts when he pulls the baby out of the crib, and it hurts also when he puts on his jacket, but it doesn't hurt to do this. So this motion here, or this motion here, when I'm raising my arm up straight like that, Ed says that doesn't bother him. But he says when he puts on his jacket, so most people kind of put on their jacket like this. And putting on your jacket like this, if you try raising your arm up like with your thumb down, you could hold your arm out here like this and just try to raise up your arm like that with the thumb down. That's called internal rotation. And you're going to be lifted. Well, I can't raise my arm much higher than that. But if I just turn my thumb up, I can go all the 180 degrees way up. So an exercise that I would try with it is to try to teach him to do more external rotation. This is an exercise called the trace. It helps you concentrate on bringing out more external rotation. So actually you're going to start in a position of internal rotation where your thumbs by your hips like this. You're raising up, and then about here, as your thumbs get to your armpit, you're going to externally rotate, turn your thumbs like this. Have your thumbs go behind your head. Have them meet at the back of your neck. Have your fingers come together and come out like that. And then fold back like that, concentrating on making your shoulders externally rotate. Okay, I'll try that again. We start down by the hip. We come up like this, and about at the armpit, we're going to turn our thumbs up like this. Touch behind the back like this. Fold back, and again, watch as my shoulder goes into external rotation. So internal rotation at the shoulder, there may be some way that he's doing. He's reaching down into the crib to pick up the baby like that. And he's somehow jamming his shoulder. So that external rotation that we talked about is going to be a way to have your shoulder resume normal activity. And Ed, that's a good simple thing to start on right now. It's a foundation training exercise. You can find it online if you sign up for the foundation training streaming. So let's go on to our next question. Okay, Don writes in from Danvers. He says, I've had a real bad pain in my back for a couple of weeks. Usually I just have my wife walk on my back like I saw on YouTube and the pain goes away. But last week when she went to do it, she said that she saw a blister on my back near where the pain was, and she didn't want to walk on my back. I definitely don't think I got a sunburn on my back this time of year, so what do you think it is? Don, a bad pain on your back, again, could be many different things, but the fact that there's a blister in that area makes me think a bit of shingles. Now, what are shingles? Shingles are a viral infection that many people, in fact, most people can get because most people, when they were kids, probably had chicken pox. It all depends on your age, whether you were successfully treated with the anti-chickenpox virus. But if you've had chicken pox in the past, unfortunately, it can come back sometimes as you get older. Sometimes our immune system doesn't have the same strength it did when we were younger. and shingles are merely that chickenpox virus that had been made to lay dormant for years inside your body coming out. And the chickenpox virus will tend to go along the course of a nerve, and sometimes it can be on our side, but it tends to go in between the ribs. And we usually think of our ribs as just being in the front, but our ribs start in the back, way back by our spine, and they wrap around to the front. So anywhere along that course of that rib, you can find blistering, and particularly if it's in the area where you have pain, that may explain what Ed called a bad pain, because the pain of shingles is a very hard pain to live with. There are some things you can do for it, but having your wife walk on your back is not one of them. So for now, Ed, I would seek perhaps some medical consultation to see if they have any antivirals on hand. There's not a lot that can be done about shingles. You can get a shingles vaccination to help it from coming again, but once it's come out, it more or less has to run its course. And I think if you have that examined, you'll probably find that your painful blistering on your back that seems to be causing your pain is likely to be shingles. So, Ed, thanks for that question. Okay, Paula writes in from Danvers. She says, I saw your show a few weeks ago where a woman wrote in about her daughter who has a problem with dairy, and you told her that calcium lactate was okay because it had nothing to do with lactose intolerance. But is there some way that I could just get plain calcium without anything else attached to it? Everything I see is always calcium carbonate or calcium glycinate, but you never see just plain calcium on its own. Where can I get just plain calcium? Okay, that is a good question. Well, if you know anything about chemistry, you'll know that calcium in its elemental state, in other words, when you find calcium like calcium carbonate, which is a form that we see in a lot of inexpensive vitamin stores, calcium carbonate is a very inexpensive form of calcium. It's a molecule of calcium and it's a molecule of carbonate bound together. So part of the molecule is calcium, part of the molecule is carbonate. But if you had just calcium on its own with nothing else, you would find that it's a metal. It's a very highly reactive metal, and the only place you can find it on this earth is in a laboratory. And it's usually in a laboratory in a sealed jar, and that jar is usually covered, the top of the calcium, with oil, because when pure elemental calcium hits the air, it almost immediately starts to burn. It's so reactive. It needs that other molecule. So when you talked about calcium carbonate, a calcium atom and a carbonate molecule binding together like that, it's because calcium is so reactive, it can't stand to be on its own. It has to be with something else. So you're never going to find calcium except in laboratory. And it wouldn't be good to try to eat something like that. It would be highly poisonous. It needs to be bound to something else. Once it's in your body, inside your bloodstream, your body can separate the two and take just the calcium, but that's a very special situation inside your body and not something that you'd ever find in nature. You won't find just pure calcium except in the laboratory. But that is an interesting question. That's why you don't see just calcium any place. So thanks for that question. Okay, Kathy writes in from Danvers. She says, my son is a little heavy and is trying to play football this year. He keeps saying that he has either hip pain or knee pain when he runs. But isn't that normal? Isn't that normal if you're heavy? I don't want to pull him out of playing when he is just starting. Well, Kathy, I appreciate you trying to encourage your son to play sports. Maybe he wants to play sports. And if he's complaining of hip pain or knee pain, it may be just normal pain after a workout. But at the age of 12, particularly if he's a little bit heavy, there is a condition that people can have that can give you hip pain that may radiate to the knee. There's a very fancy name for it. It's called slipped capital femoral epiphysis. So you're never going to remember that. But what it means is your femur, which is your thigh bone, up here by your hip, it looks kind of like, the end of it looks kind of like a ball. And when we're young, there's a line. And that line on the head of this ball joint is a line, what they call the growth plate. And that growth plate is there in order for the leg bone, the hip bone, to grow longer, to allow us to grow taller when we're in the age of 12 and until our growth period stops. Sometimes, particularly if we're heavy and about that age period, this top part of the plate, it can slip a little bit. And if it slips, it means that this growth plate has come undone a little bit from the rest of the ball. And if that happens just a little bit, it can be okay. But if it happens again and again, particularly if we punish that area by being too heavy, if we punish that area by playing sports, running too hard, having that condition, you may find that area slips off and the bone would grow in an altered fashion and maybe not grow to its fullest length. So the simplest way to find out is to take an x-ray. It doesn't require an expensive and time-consuming MRI or CT scan. A simple x-ray will determine whether a person has a normal growth plate in that area and whether it slipped at all. So I would suggest take your son, have an x-ray taken. It can be taken by virtually anybody who knows how to take and read an x-ray, and just see if he has this condition. I know you're not going to remember the fancy name for it, which was slipped capital femoral epiphysis, but I wouldn't just poo-poo your son's complaints. It may be just entirely normal that he feels some hip and knee pain after a hard workout, but it could also be a sign of a condition that's something that he can't help and that could require him to stop running for a while until that area stabilizes and until he heals. So thanks for that question. It's not something we see too often, but when it happens to somebody, you don't want to let it go and have it be the reason for a lifelong of hip problems. So that's about all the time we have for today. And so I'd just like to thank our viewers for watching and let you know that you can participate in our show just like the people who sent in their questions today. You can send in your questions via email to pbdchiropractic@gmail.com, or you can call my office at 978-535-6155. You can even send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts 01960. But whichever way you choose to participate in the show, we'll slightly disguise your name so your friends and neighbors won't know the nature of the question you're asking. And we'll talk about natural health means to help you get better, because most conditions don't require drugs, don't require surgery, but can be helped by natural health means. And I've been doing it now for 37 years. I still enjoy helping people get better and avoid drugs and surgery. And I try to stay fit that way myself. So thanks for watching. See you next time. I'm Dr. Stephen Blomerth for Natural Health Today. Bye-bye.